All right, thanks very much for the invitation. It's great to be with you guys virtually, and I hope we can find a time to get together in person in one of our places, or in Rostock, or other demography gathering spots in Europe. Today, I'm going to talk to you a bit about some of my research on COVID mortality, and a lot of this is kind of me thinking back retrospectively on the last 3 years or so. I did a lot of COVID work, and also trying to think how this, sets an agenda for us as demographers going forward, especially those of us interested in population health and mortality. So these are the US and the UK are the two countries I'm going to focus on most today. Dear to my heart, being originally from the US, and I'll say I just got British citizenship a few weeks ago, so I'm kind of officially, invested in both countries. And I'll also say, even though I'm a new British citizen and had to take the Life in the UK test, I sometimes still misuse my language of UK and England and Great Britain. And so I know you guys in Scotland are probably sensitive to that. So I apologize. The data sources come sometimes from different places, and I'll try to speak as accurately as I can there. Thank you for the congratulations. So to start off, yes, I'm going to give a little overview of kind of how I first got started thinking about demography and COVID right off the bat in March 2020. Kind of take us through the history of pandemic mortality in the US and the UK, and then think about what might be next, and how we might hopefully contribute as a discipline. And so, if you can put yourself back in that frame of mind from March 2020, it seems like a million years ago, but, we really had very little data, in the early days, and there were really important questions that we needed to know, such as how fatal, how deadly is this new pathogen? Because the answer to that question would really inform all of the actions that we might take as societies, from shutting down schools and shutting down everything has ended up happening. So, very early on, we were trying to get a handle on things like this basic case fatality rate, which was the percentage of, cases that ended up dying upon infection. And, Italy, as you all recall, was one of the first places to get hit particularly hard by COVID mortality outside of Wuhan. And so we were watching with great interest. In fact, some of our colleagues in the center that was brand new at the time were from Italy and headed back there in February, and were kind of sending us reports. But they were putting out really great daily statistics about confirmed cases and mortality. And this, this type of figure is what jumped out to us very early on. And again, we know that cases were probably drastically underestimated at this time. This was, people who were coming into the hospital that were receiving tests. So these numbers are kind of artificially inflated, but, it was quite alarming to see case fatality rates this high. And we noticed very quickly this very strong age pattern, which as demographers kind of, made us, lit up our minds in thinking about the implications of that. And it also is something to, to understand about this particular novel pathogen, because things like the 1918 flu pandemic actually hit younger age groups very hard. So this was, kind of a very important fact that we learned as we went along. And we quickly learned that, all demographers were actually thinking about this at the same time. So we put out a preprint kind of about the potential importance of age structure, across and within countries for COVID mortality. And Monica Alexander pointed out how we were just kind of saying what was on every demographer's mind around the world. And so I thought that was funny that we were all converging on this idea. And our group put out then a preprint and a paper in March 2020, just kind of thinking about the implications of age structure, given the very strong association between age and mortality that we saw with COVID, and just doing some counterfactuals with countries with different age structures to see what we might expect to happen. And I think that pointed to another, very important contribution of demography early on, was to kind of remind people about the importance of denominators, and that in trying to pinpoint something as important as what is the actual infection fatality rate, with the steep, relationship between age and mortality that we saw, this meant necessarily that that summary infection fatality rate was highly dependent on the age groups that were getting infected, the age structure of the population where that was being measured. And as I said, we did not really know the true denominator of how many people were infected. So within a few months, there had been some really great surveys, population-based seroprevalence studies in Spain and England, which continued to do them for a long time. That got us a much better estimate of that denominator of how many people had truly been infected. And we were able to get a better handle on this infection fatality rate. And still see that age was one of the most important factors. And in fact, this paper found that 90% of the variation in population infection fatality rate across geography was due to differences in age composition of the population. And so this continued to be important throughout the pandemic, as you'd have a new wave, and people were, asking, is this new variant, less dangerous than the past one? It was often kind of a function of who was getting infected early on and what age groups and occupations were contributing to that data. So this is just me pointing out that I feel like demographers had a lot of skills and kind of baseline knowledge that we took for granted that was extremely important with all of this raw data coming out of the pandemic. And it was coming out fast and furious in those first many months. And I know so many people in our community kind of dove right in and tried to make sense of it. And I just wanted to remind us that this was crucially important to get kind of basic facts about the pandemic and the fatality rate, nailed down early on. And, I think we rallied and did a good job in that respect. Of course, the other concept that became very kind of mainstream during the pandemic that has a grounding in demography and became very useful was the idea of excess mortality. So you guys also, I think this was very big in the US, but there was a lot of rhetoric, especially from Trump, asserting that we were overcounting COVID deaths, that people were dying, with, not of COVID, and really trying to minimize the impact of COVID, of the dangers of COVID, by saying that lots of these people were going to die anyway. And, to be fair, if we are showing that it's strongly associated with age, COVID mortality, that the oldest people are most at risk, then, I think it's a fair question. Does that mean that a lot of these people were just close to death anyway, and we're sort of pulling those deaths forward a little bit? And excess mortality, I think, became a really powerful concept, even to the general public, to explain, we don't actually have to have a confirmed COVID death. And Trump, was also, often saying that doctors were having incentives in the US to code a death as COVID, that if someone came in from a car accident or a gunshot wound, as might happen in the US, and they, were COVID positive, they would get coded as a COVID death. So there was a lot of this misinformation. And of course, excess mortality only counts deaths from all causes. And it compares deaths that we're seeing now to a baseline, sort of a counterfactual 2020, where COVID didn't exist. And then, we can see how many more people were dying. And I did a fair amount of science communication during the pandemic on some social media platforms. And I was kind of amazed at how intuitive this concept was at really helping people understand, no, we actually do know that a lot of people are dying specifically because of COVID. And I always kind of liked this figure, I think, from the New York Times from the very first half of the year of 2020 in the US, because it really showed the movement of the pandemic across geography in the US. The excess mortality tracked the movement of the virus itself, starting in the Northeast in New York and then moving across the South and West later. Because of course, a lot of people were claiming early on that excess deaths were going to happen, due to the lockdowns and restrictions, but it was clear that it was following the path of the virus itself. And this is, again, just pointing out that in the US, this piece of misinformation that the government was exaggerating the number of COVID deaths persisted from early in the pandemic. And I think this survey is still from 2022. So this is a piece of kind of misinformation that has really persisted and that I started writing about on these social media platforms back in 2020. And as I said, they always ended up being some of the most popular posts to share with family and friends, because I think this idea of excess mortality actually made sense to a lot of people. And suddenly we were starting to see excess mortality estimates in all sorts of publications like The Economist and the Financial Times. And these figures just became very familiar, I think, even to the general population. So that brings me to kind of thinking about what has happened over the course of the pandemic in the US and England in this figure. These are estimates of excess mortality in England starting from March 2020 up till recently April 2023. And just a couple of things to point out: these darker green bars at the top are times when there were fewer deaths than expected. And so I think that it's interesting because you'll see that does not appear in the US, but England had some periods, especially after lockdowns, or during and after some of the lockdowns, where there was negative excess mortality, fewer deaths than expected. That could be attributed to mortality displacement, that actually the people who would have died during that time had already died a few months sooner. Or it could be, fewer deaths than expected due to other infectious causes, fewer accidents. And I think there was probably some displacement going on, but my guess is we actually saw fewer deaths from causes that we normally would have seen that were expected, other infectious causes. And you can also note in the top here that the total excess deaths in England are actually lower than the confirmed COVID deaths. And again, I think some of this negative excess helps explain that, but probably also that compared to the US, at least, there was more accurate and inclusive counting of COVID deaths on the death certificate. In contrast, we can look at a similar figure from the US, data from the CDC, and you can see from these red hash marks that mortality has pretty consistently stayed above expected deaths since March of 2020, and we never saw the negative excess as we did in England and Wales in the US. And we'll kind of go back and look at this a little bit, but if you look at England, you can see that the levels of excess are very muted after kind of the completion of the initial vaccine rollout. So the Delta variant hits in the summer of 2021, and we do see excess after that. And then with Omicron era that we've had recently. But in the US, there was, a huge excess again with the Delta and Omicron variants, that was as bad or possibly even worse than previous waves. And this was all post vaccine rollout. So we'll talk a little bit about the differences there. And you can see this persistent excess that continues even to the present. And here we can see that the US had more I think I have that backwards on the estimated excess. So actually it should be that the US has more excess than official COVID deaths. And that has been the case pretty much all along. And a lot of studies have tried to look at that, pick that apart in the US. And, while there have been some excess deaths due to increase in drug overdose and external causes in the US, a lot of that seems to be undercounted COVID in the case of the US, that non-COVID excess that we see tends to track the COVID waves very closely in the US. So this is a case where we actually probably were undercounting, and excess deaths gave us a better picture of what was going on. And this is another viewpoint of cumulative excess mortality from our world and data of the two countries. And this is where I think you can see the divergence that happens after the vaccine rollout, kind of in summer of 2021. You can see that England was hit a bit harder in that very early wave. And I think this makes sense because it was hit early, and, London, and that makes up a higher proportion of the population in England than, New York City was hit quite hard, but a lot of the rest of the country in the US was not hit very hard early on. So it took a little while for the virus to spread more broadly in the US, but they do kind of catch up. And then you can see it kind of tracks pretty closely until the period, where the vaccine rollout became important in that summer of 2021, where the Delta variant hit. And then the US really takes off and has much higher cumulative excess than the UK. So excess mortality has been a really great way to kind of track what was going on, and something we could do from a really early stage in the pandemic. But it is a little bit hard to directly compare it across countries, of different sizes and age structures. So demography, also has this great metric of life expectancy that kind of adjusts for this and makes a more comparable measure across time and space. So we can compare COVID mortality across countries and also kind of look at it in the context of other historical mortality shocks. And so I was part of some efforts, first with the 2020 data and then the 2021 data, to kind of take stock of how COVID had impacted life expectancy. And this was the first paper that came out from 2020. And you can see life expectancy declined in all of the 29 countries that we looked at, with the exception of, I think, females in Finland and both sexes in Denmark and Norway did okay in 2020. And in most countries, males experienced larger losses than females. And I always think it's quite stunning to just look at, pre-pandemic US life expectancy. If you look there, is worse than pandemic life expectancy in a lot of other countries. So it's worth keeping in mind the baseline mortality in a lot of these countries. But this was a big hit in 2020 to life expectancy. And we also looked at what ages were contributing most to those drops in life expectancy. And as you would expect in a lot of countries, these were deaths at older ages that contributed most to the life expectancy losses. But the US was particularly, an outlier in that respect, and deaths under age 60 actually contributed a lot to the losses in life expectancy, even in 2020. And we'll see that actually shifted even more so to younger ages in 2021. And if you look at England in this, you can see it's concentrated a bit more in the 60 and up, and not as much in the under 60. So 2021 came along, and I think, again, for a lot of us living through this and trying to analyze this data and think about what's next, it seemed like a very hopeful year. The vaccine started rolling out in December, and efficacy was estimated to be very high in those first trials. And I just remember us all really feeling like this was the turning point. And so there was a lot of high expectations. But of course, in the end, there was variability in the vaccine rollout. And we also saw the emergence of these vaccine and immune-evasive variants that were also just much more highly transmissible. So, with the Delta variant in the summer of 2021, and then later Omicron, I think it's hard for us to understand, but the sheer number of infections increased tremendously. I mean, and you can probably all realize it based on a lot of people have already been infected twice or more. So, even though we saw high mortality in an unvaccinated population in 2020, in 2021, we just saw many, many more infections, but we started to have at least this vaccine protection to counteract that. So it ended up being a bit of a mixed bag as far as mortality was concerned, and more kind of heterogeneity of experiences across countries, which I think makes sense as there's a lot more variables at play. And so this is our figure for trying to look at what happened in 2021 with life expectancy. I think it's a great visualization that my colleague Jonas Scully came up with, but I realize it takes a little time to orient to. So just to explain here, the top line is the change from 2020 compared to 2019. So a red is a loss of life expectancy. And the bottom kind of part of that squiggle for each country is what happened in 2021 compared to 2020. So if you have a little blue squiggle, you're kind of headed back in the right direction and regaining some of that loss. But if you have a longer line, you actually lost more life expectancy in 21 than you did in 2020. And you can see the months there on the right of lost life expectancy for each year. So again, kind of keeping the focus on the US and England, you can see that the US did really poorly even in 2021, despite the vaccine rollout, and lost an additional several months of life expectancy for a total of 28 months from 2019 to 2021. And they're kind of up there, ranking with Bulgaria and Slovakia as its kind of peer countries in COVID mortality performance. England did a little bit better, recovered a couple months, so had, a slight bounce back, as we called it, and overall, not nearly as large of a magnitude of life expectancy loss as was seen in the US. And again, we kind of broke this down by what ages were contributing the most to these life expectancy losses. Again, lots of squiggles that are a bit hard to see. But I think that the interesting take home was that the mortality in many countries shifted a bit younger in 2021. And I think this probably made sense in that older people, compared to the first few waves where they might have just been very vulnerable in care homes, et cetera, probably as time went by, taking better precautions, and also kind of the first to get that vaccine protection in 2021, and typically had very high take-up in those age groups. So you can see that actually in the US, the 80 plus kind of recuperated their life expectancy, in fact, in 2021 compared to 2019, but this was offset by even, worse losses in those younger age groups. And so that's also a pattern that we did see in especially other Eastern European countries, but was pretty exaggerated in the US compared to other peer high-income countries. And England and Wales, again, since they kind of recouped a bit overall in 2021, you can see this similar pattern of recouping a lot of that lost life expectancy at the oldest ages, and a little more happening in that middle age group, so shifting a bit to younger ages. But one important point was that, despite a few countries, getting back to where they had been in 2019, no country that we looked at had actually gotten to where they were projected to be in the absence of the pandemic. So these are Lee Carter models for forecasting what we would have expected life expectancy to be in 21. And even countries that fared quite well, like Norway, did not achieve the life expectancy that would have been expected in the absence of the pandemic. So to summarize 2021, we really saw this divergence in the impact of the pandemic on mortality. And there's probably a lot going on there with different vaccine rollouts, and just much more heterogeneity in restrictions and policies and kind of culture around taking different precautions. But we saw, some countries bouncing back from big 2020 losses, but many others, including the US and a lot of Eastern Europe, seeing sustained and substantial life expectancy deficits. So that kind of brings us to thinking about 2022 and beyond. And unfortunately, I don't yet have, because kind of the time it takes for the data to come out, the 2022 life expectancy estimates themselves. But we can look at what's happened with excess mortality in the past year. And I think 2022 really did feel different. It was kind of the time where everyone who wanted a vaccine in high income countries had been able to get them, including boosters. But we saw the emergence of variants like Omicron and BA5, and later on in all of the alphabet soup we have again, of kind of increasingly transmissible and immune evasive variants that made it look like we might never quite get ahead of COVID. And that's also when the US kind of started to diverge even more. So the US obviously was hit quite hard in 2020, but its performance compared to the rest of Europe and England started to diverge even more kind of from the summer of 2021 when the Delta variant emerged. And again, I think there's still a lot of work to be done. It's hard to do these cross-country analyses to pinpoint causal mechanisms, but there's been a lot of looking at how different data fit and that might be able to explain these differences. And John Byrne-Murdoch of the Financial Times did some nice counterfactuals looking at the different vaccine uptake as well as booster uptake in the US compared to some other countries over that time period. And he estimated that would have been many fewer hospitalizations in the US during the Delta wave if they had reached the vaccine take-up, especially amongst age 60 and over. So this figure is the percent of over 60s by number of doses. And, it does look like the US gets to a pretty high coverage of any vaccine, but, they really had low booster uptake. And so kind of by the autumn and winter of 2021, it became clear that a third dose really was necessary, more as part of the primary series. And you can see in England that led to a very rapid take-up of boosters. Practically everyone got it in a month or two. And the take-up just remained very low in the US despite public health encouragement. And that was estimated to contribute to a lot of excess hospitalizations and also deaths, because especially if you're missing vaccinations at those older ages, that's where it can add up to a lot more deaths. So this was John Byrne-Murdoch's counterfactual if the US had the same vaccine coverage as Denmark, for example. And also after that period of July 2021, the death rates in the US compared to England started to be dramatically higher. And this was actually more evident kind of in the middle ages. You can see the relative differences in 55 to 64-year-olds, for example, was 3.8 times higher. 45 to 54-year-olds was 5 times higher. And again, it's my hypothesis that a lot of this was also due to differential vaccine uptake. While the take-up at the oldest ages, was quite good in the US, it was still worse than England. Sort of in those middle-aged range, there was much lower take-up in the US compared to England and Wales. And so I think that started to be reflected here quite quickly. And looking at, what's happening in 2022, This is from the HMD dashboard. They have a really nice shiny app where you can calculate excess mortality for lots of different countries. And so this is the picture from 2022. You can see that the US got really badly hit by the Omicron wave in that early part of 2022, still very high mortality, which was really non-existent, no excess whatsoever in England and Wales during that time. And so again, I think it's not a coincidence that practically everyone in England and Wales got a booster shot in December of 2021, and it was very quiet on the mortality front during the Omicron wave that was very dangerous elsewhere. Then you can also see, after that, I think the real interesting kind of new phase that we're in has started more at the midpoint of 2022, where we've seen sustained excess, both, in the UK, but also in the US. And in the UK, a lot of that, excess was tracking COVID mortality very closely through most of the pandemic, but since the summer of 2022, there's been a higher fraction of non-COVID excess in England and Wales. And that's, something that our team is also trying to explore. And I'll say the dips where it looks like negative excess mortality in England and Wales is probably a function of bank holidays. I'm guessing that was the Jubilee, where registration kind of gets messed up. So that's something to just look out for in the raw data. But what could be really contributing to this much higher mortality in the US? I think the vaccination uptake is a real prime candidate for explaining this, but I think it's also important to remember that the US has been lagging behind in life expectancy compared to European peers for quite some time. And there also appears to be a deterioration or, a disadvantage in overall health, even at the same ages. So this is a comparison of the US and England from ELSA and the HRS study from ages 55 to 64. And the US is worse, on a lot of different metrics, from diabetes to high blood pressure, and certainly obesity. So I think there's something about underlying health conditions that also shifted the age distribution of deaths slightly younger in the US compared to many other countries. But the vaccine story, I think, is a big one, and also a very sad one in the US. You guys probably have followed some of it from afar, but kind of everything about the pandemic became very politicized, early on, a lot thanks to Trump. And, masking became quite a partisan symbol. And then that also happened, unfortunately, with vaccines. And so you can see, again, I think this was from summer of 2022, but you can see that only 36% of Republicans report being vaccinated and boosted, compared to 70% of Democrats. So it's not just a small kind of partisan gap in vaccinations, it's actually quite substantial. And people have looked at that across Europe for kind of political extremes. And there's small differences in vaccine take-up, but nothing near the polarization that we saw with regards to vaccines in the US. And there was a really interesting paper that came out a few months ago that kind of linked individual level voter registration data to county level COVID mortality data, and showed that excess deaths in these counties and for Republicans and Democrats really tracked closely to one another through most of the pandemic. But when vaccines came on the scene, there was this divergence with much more excess deaths amongst Republicans. So this, to me, is a really just sad story about the politicalization of public health having real human costs in the US. And I think this is a problem that's continuing. So our team is trying to understand more what's happened in England and Wales with regard to excess mortality. by creating some models that disaggregate this by individual cause. And, so far this is still preliminary, but I think our take homes so far have been that there was actually lower than expected mortality for suicide and substance-related mortality. This was a big fear of a lot of people, that we would see increased mental health problems, suicide, substance abuse. And so far, we see very little evidence that that happened in England and Wales. As I mentioned, there were some evidence of increased drug overdoses in the US during the pandemic, even from very high levels already. But it was consistent in the US and many countries that there was no evidence of increased suicide. So that was at least one piece of good news. We also were looking for evidence of some excess cancer mortality. There was a lot of concern about foregone screenings, treatments during the lockdowns, and people just staying away from healthcare. And we actually have seen no excess in cancer deaths, even, kind of negative excess early on in the pandemic. So we think that's an interesting finding, and something it'll be interesting to follow in the future and see things that might have longer lag times if that ever emerges. But what we do see as far as the emergence of non-COVID excess mortality is mostly attributable to cardiovascular disease, this yellow that you see kind of from July 2021. And so that seems to be what is staying persistently elevated even through 2022. And, we're concerned about that, thinking about the future. There are, several hypotheses that I think all need to be tested, but again, the Financial Times is good at some good data visualizations to propose these ideas. And John Byrne-Murdoch did a really very good piece about the NHS wait times, the A&E wait times that were especially acute over this past winter, but even since last summer, when this excess, non-COVID excess started to emerge, they were much higher than normal ambulance wait times. So again, the hypothesis is that this contributed to non-COVID excess. And I think, again, that's something that requires probably more individual level data to try to tease out, possibly leveraging differences in wait times across geography and time to see if that's really it's certainly a plausible explanation, but I think it's unconfirmed at this point. I think something that concerns me, I studied associations between infections and chronic disease even prior to COVID, and there's emerging evidence, again, it's not rock solid at this point, that COVID infections increase your risk of a lot of vascular diseases, at least for some follow-up time afterwards. So, whether it's heart attack or stroke, and yeah, heart failure, pulmonary embolism. So this is something that, because of the mass scale of the infections that we saw, we could be seeing in the data an overall elevated risk of cardiovascular disease. And I'm not saying I agree with this interpretation at all, but a lot of people were surprised that Queen Elizabeth didn't live as long as, I guess, her husband or her mom, and she had COVID earlier in the year that she died. So yeah, leave it to Twitter to speculate there. But this is the idea that there's some possibly elevated risk across the population that we're seeing show up now. So I think for me, someone who's very interested in population mortality and had already been concerned with some of the stagnation that we were seeing in the US and also the UK, I think the real questions for me are, are we seeing, a new mortality regime? Are we ever going to go back to kind of that a lot of times you see a shock and a return back to normal, and that hasn't happened yet. So What the new baseline burden of COVID-19 will be is really not yet clear. It's clearly not endemic in the sense of having a predictable seasonal pattern. There's a lot of uncertainty around new variants, vaccine efficacy and durability, new treatments that might emerge, the impact of reinfections, et cetera. And then I think there's still a lot of work to be done on understanding the lagged impact of all the delayed healthcare that did happen. So I think it's great that we're not seeing that show up in cancer yet, but we shouldn't think that we're going to get off scot-free there. And obviously there's screenings for diabetes and heart disease and things that also were missed. And then the overtaxing of the health services, which again varies a lot by country, but these are things that we need to think about for the future. Mortality displacement, there were some countries that lost quite a high percentage of older people relative to other countries. And so in those countries, I think we do see some mortality displacement where those deaths were pulled forward, and consequently we see lower mortality than expected. But in most countries, I think it's interesting that despite that, the potential for that mortality displacement, we're still seeing elevated mortality overall. And again, some of that probably is due to these potential long-term effects of the infection itself, or just the having a serious illness. If you were hospitalized or on a ventilator, obviously can be a seriously disabling event. And then a lot of us who study social determinants of health, I think, are interested in the long-term impacts on health of all of the social and economic disruptions that were associated with the pandemic. And in our life expectancy paper, we also tried to put these losses in historical context with other historical mortality crises from the past 120 years. And this was the 2020 through 2021 data, but we found that losses of this magnitude really hadn't been seen since World War II in many countries, or the Soviet mortality crisis in the Eastern Bloc countries. But what's interesting with a lot of the flu pandemics that were, serious at the time is that, substantial losses to life expectancy were recovered to pre-crisis levels within 1 or 2 years. And it already looks like, that's not going to happen with COVID. So just another another point that COVID was not just a bad flu, which I think is obvious by now, but also this question of, will it persist and affect, kind of change the baseline for mortality going forward. And this is a hot off the press. So it's figure from Jonas Scully, who is in the process of estimating life expectancy for 2022. So I don't have those top line figures, but just wanted to point out he did these Lee Carter models to show the deficits for many countries have persisted for a third year from what would have been expected. And so this is kind of the burning question is, are we, not going to return to a pre-pandemic trajectory of mortality improvements? Are we, facing an adjustment that's more permanent? And I think, this will be something to really try to understand, look at who is still at elevated risk of mortality. When I think about it, it's clear that COVID is still very dangerous for older people and for immunosuppressed people. So in trying to look at the 2022 data, I wondered, so who, can we see if excess deaths are concentrated, only amongst the oldest people right now? I didn't know the answer to that. So using the HMD tool, I kind of broke this down by age. So the US is there on top and England and Wales on the bottom. And you can see this excess mortality is there for 85 plus, although England and Wales had that period of negative excess in the winter of 2022. But if we go younger, we see a lot less going on in England and Wales for 75 to 84. But, we still see this excess, especially in the US, for 65 to 74. And then I think this was the one that, surprised me. This is not very disaggregated, so I'd like to kind of see this in the smaller age groups. But I think, the fact that we see, again, the absolute magnitude of these deaths is lower than the older age groups. But the fact that we're still seeing significant excess, in younger age groups and probably middle-aged age groups in both countries is something that points to me that this could be a long-term impact of the infection itself, or something that might be sticking around as a persistent elevated risk of mortality. And I guess the good news is we don't see that excess in younger age groups a little bit. In the US actually was hit, I guess both countries were hit very hard this winter with flu, RSV, and COVID, which hit some pediatric deaths quite hard. So I'm guessing that's what's happening there in the US. But overall, it's, the silver lining is that we don't see that elevated mortality at younger ages. So yeah, this is kind of where our team is in thinking about this, is trying to understand what is in store for mortality, not just in these two countries, but more broadly for all countries in going beyond 2022. And we have all of these hypotheses of things that might be contributing to persistent excess mortality. But these need to be actively tested, and the data is starting to become available, I think, to test some of these hypotheses. So I encourage all of you to, if you're interested, to think about these issues. And then finally, just before we open it up for discussion, I think, and this is something that my colleague Jonas mentioned when he was just visiting last week, was we've seen these consistent gains in life expectancy in most countries for a century. We have had these blips with the 1918 pandemic and world wars, but we often kind of justify optimism about society in the long term by this very consistent rise in life expectancy. And so it will be interesting if we really have kind of knocked ourselves off of that trajectory in a significant way and are facing higher baseline mortality than we have pre-COVID. How does that, how does that impact our thinking about whether society is doing what it should be doing to protect and promote human health? So I'll leave it there, and I look forward to your comments. Thank you.